This is a presentation of Chapter 10, Reluctance Illustrated, Policy Uncertainty During the Presidency of Bill Clinton. These are some of the key events in the presidency of Bill Clinton. In 1992, Bill Clinton defeated George Bush and Ross Perot for the presidential election. In 1994, Republican leaders issued the Contract with America. Also in 1994, Republicans obtained control of both houses of Congress. And in 1997, Bill Clinton was impeached. Despite losing in a 1974 House of Representatives race, he was elected Attorney General in 1976 and became the governor of Arkansas in 1978. Clinton became the youngest governor in the U.S. in 40 years. As a Southern politician, he had to promote a moderate or conservative image to be successful. After Clinton repeatedly retreated from his liberal policies and demanded that the Democratic Party become more moderate, people began to wonder if he really had any consistent values or if he just wanted power and to be liked by everyone. By the 1990s, the Democratic Party experienced a deep rift over affirmative action, liberal welfare programs, and the state's policy roles that made way for the rise of Bill Clinton. Voters believed George H.W. Bush was unbeatable in 1991, but Clinton faced unknown candidates for the Democratic nomination in July of 1992. This created a window for him to take over as party leader. Clinton's campaign strategy emphasized improving education, drastically reforming health care, and slashing taxes for middle-class Americans. The election was further complicated by Ross Perot, who was a billionaire third-party candidate that ultimately received 19% of the vote. Clinton won the election by the narrowest margin since 1968. As part of the budget process, the president submits a proposed budget for the next fiscal year, typically in February. In it, he explains how much he wants to spend on each program, whether he wants new taxes, and his estimate of the expected budget deficit. Federal spending can be placed in two categories: entitlements and discretionary spending. Programs such as Aid to Families with Dependent Children, otherwise known as AFDC, Medicare, Medicaid, and food stamps, are entitlements, and the funds for discretionary programs are determined each year. Clinton recommended two types of extra spending. The first one is an immediate economic stimulus and social investments to get the economy moving. In mid-February, House leaders unveiled his $30 billion stimulus program. The House initially refused to pass it, but it was later passed with most of its initial resources removed. The United States had created a healthcare system based on private insurance firms and businesses, and Clinton recognized numerous faults in it. The monthly premiums for private health insurance coverage for employees and their families were often paid in part or in full by many companies. This system worked effectively for those who were insured by it, but not so well for those who were unemployed. When Hillary Clinton was appointed to oversee healthcare reform in 1993, she recognized that providing coverage to uninsured Americans would incur significant expenditures in the short term. A proposal was offered in a nationally broadcast address to Congress in September of 1993, but many thought it was much too complicated and there were concerns about the plan's cost. Congress almost immediately rejected Clinton's idea. In August 1993, Clinton detailed the main parts of a Democratic anti-crime strategy that centered on expanding the number of police officers, additional federal death sentences, and fewer appeals for death row convicts to prohibit Republicans from profiting financially from crime in America. The plan was signed in mid-September and provided $8.8 billion to hire 100,000 new officers, $7.9 billion to help states build new prisons and boot camps, and $6.9 billion for social programs, including $1.6 billion to fund the Violence Against Women Act, which provided federal penalties and programs to reduce domestic violence. Under the 1994 elections, Republicans took control of both chambers of Congress, and the Republicans created the Contract of America. In the Contract of America, the Republicans promised to balance the budget and tax limitation, strengthen the national defense, cut taxes to strengthen families and to benefit middle-class people, give aid to senior citizens, provide welfare reform, reform unfunded mandates and incentives to businesses, strengthen the family, and put legal reforms to curb litigation, create anti-crime legislation, and introduce term limits. A budget battle between Democrats and Republicans, as well as the White House and Congress, was the biggest political event of 1995. Newt Gingrich wanted to erase food stamps, Medicaid, and AFDC and turn them into money for the states. As a result, the federal government's inability to pay its debts forced the government to shut down for an extended period of time. Conservatives attempted to make late-term abortions illegal in 1995, putting women's reproductive rights at jeopardy. During Clinton's first term, affirmative action policies that helped people of color and women obtain jobs, education, and government contracts came under increasing political scrutiny. With the passing of the Proposition 209 in California in 1997, which prohibited public colleges from showing any preference for people of color in their admissions procedure, the argument over affirmative action became even more heated. This compelled policymakers to pay greater attention to improve secondary school educational program for people of color. Clinton advocated generally liberal policies during his first 2 years in office, including social investments and health reform. A rising Republican minority in both chambers was able to join forces with moderate and conservative Democrats who were opposed to the president's ideas. No government exemplifies the struggle for resources that liberals face more vividly than the Clinton administration. As the Clinton administration tried to reduce the nation's budget deficits in the 1990s, a significant concern was a shortage of resources for discretionary social expenditure. President Bill Clinton's policy efforts proved that the government can and should assist working people of moderate incomes.